Let's move on and say one more word about the prices. This is an illustration that's in our auxiliary memo on the illustrative alternative. And this shows future price levels for Medicare, Medicaid, and private health insurance. It shows it all relative to private health insurance. So let's say that defines the standard at whatever it might be, and at 100%, it just stays at the level it is now, relatively speaking. And those are the prices typically negotiated between plans and providers. And we know, of course, that Medicare payment rates are lower than that, and Medicaid is somewhat lower than that. In this chart, I've suggested that Medicaid payment rates would probably have to continue to look about like they do today relative to private health insurance payment rates, and that's roughly 70% as high. We already have access problems, especially for physicians, for Medicaid. So I've kept it at 100%, even though there are reasons to think it might be higher or lower than that. Now, what happens with Medicare with these 1.1% lower price updates every year? And also reflected in there are the physician reductions under the sustainable growth rate system. And you can see that in this illustration, within 10 years, Medicare payment rates overall would be lower than for Medicaid. And if you go to the end of the period, if all this keeps happening, they would be about half the level of Medicaid payment rates and only a third of the level of the private health insurance. Now, there's lots of people can criticize about this chart. The intention is only to show that these things compound over time and have a very important effect. And that by itself says these would not be viable. You can't pay somebody a third of the going rate and expect to get them to be willing to treat your patients. The solution has to be the productivity or the other efficiencies, and that's not obviously going to work. It can work, but only with major transformational change to the healthcare system.